Hi there, it's Dr. Kramer and Baby Harrison, and we're here for the next episode of Virtual Visits with Dr. Ted. So first, I just wanted to say congratulations for making it to 6 months. It can be a challenging first 6 months. Of course, you're probably smiling more than ever, but probably very exhausted. But I'm excited that you've made it to 6 months and that you're still watching my show. So, a few things. First of all, these Virtual Visits with Dr. Ted are short videos that describe what to expect at each visit. Today we're going to talk about that 6-month well child visit. And again, they feature Baby Harrison. So, first things first, whenever you come in for your visit, I will always ask the parents if they have any questions or concerns today. And I will answer all of those questions, all of those concerns. We'll also go through any past medical problems that we've talked about at the previous visits or any sick visits since the last visit, just to make sure those have gotten better, making sure that we have a good treatment course for any chronic conditions, and making sure that's all going well. When we get to the new information for 6 months, the first thing we always talk about is feeding. So at this point in time, they should be predominantly breast or bottle fed. If they are breastfed, they should be fed usually around 4 to 6 times a day. And if they're bottle fed, they usually take 4 to 6 bottles a day. And usually the total amount they take should be somewhere between 24 and 36 ounces of formula at this age. Again, cow's milk formula with iron is what's going to be most important. There's lots of different types. Some babies need special formulas. We'll talk about that if needed. Again, prior to 6 months, no water. Small amounts of baby foods between 4 and 6 months is fine. Fruits and vegetables is fine. But it's also okay if your baby hasn't started any baby foods at 6 months. Actually, the AAP recommends, which is the American Academy of Pediatrics, all the pediatricians in the country, recommends waiting until 6 months to start that. But again, it is safe at 4 months as well. So, introducing baby foods, I think we talked about it a little bit at our last visit, but we're going to talk about it again today because 6 months is a great time to start introducing those baby foods. So, first thing first, baby foods, we want to introduce one at a time, so one food at a time, and those baby foods, it's great to start with vegetables, or some people start with fruits, but I recommend vegetables. Often people start with orange vegetables like carrots, squash, sweet potatoes. Those are wonderful, and then switch to green vegetables like green beans and so forth. Gerber and other baby food brands do have a little starter kits that have some of those vegetables to start with, but you don't need to get one of those kits. You can make your own baby food at home too. Just puree the vegetables. Make sure that it is nothing that they're going to choke on, and make sure it's very loose, very runny. So baby food is great to introduce. The big thing is we want to make sure the babies don't have any food allergies. It's super rare, but we don't want to miss it, and we want to know which food caused it. So introduce one new baby food every 3 to 5 days. For Harrison, we wait 3 days. And then introduce a new food. Once he's already had a food, he can keep having it over and over again, even while you're introducing other foods, because we know that's not a problem. And then we can watch the new foods to see if they have issues. Again, food allergies are rare in kids. What you would see, sometimes it can be subtle, like a fine rash. Sometimes it can be a change in stools. But no, introducing solid foods like baby foods, we're going to expect some change in stools, because before that they've only had formula. And then vomiting would be the other issue. Again, normal spit up we'd expect, but vomiting is the other issue. So those are the things that we kind of look at for feeding. Small amounts, small sips of water at this age is okay. But again, I don't recommend doing a lot of water at this age. I just don't need it. But it's a little safer now than it was before. No honey until a year of age. And then more finger foods, we're going to wait to start those probably until about 6 or 7 months. Again, when I start baby food, I usually would do just one feeding once a day until the baby gets accustomed to it, and then you can increase to 2 or 3 feedings a day of baby food. But again, still at this age, mainly formula, breast milk, but can introduce those baby foods. Wet and dirty diapers, again, we want to see at least 3 wet diapers. Dirty diapers can really vary. Hey, buddy, you talking to us? Yeah? Those dirty diapers can really vary. Again, we're expecting them to vary even more once you start introducing baby foods. That consistency can change. That runny, seedy, loose yellow or green can get a little bit thicker again. Should still be soft. Mashed potatoes or peanut butter consistency is fine. But that's for bowel movements and wet diapers. The exciting part is by 6 months, they should be sleeping through the night. Parents love that. If your baby's not, I recommend doing sleep training. And I will do a separate video that talks about sleep training because it's so important, but does take a while to explain. But if you want to read a book about sleep training, Solve Your Child's Sleep Problems by Richard Ferber, he's a pediatrician, is the book to read about sleep training and getting your baby to sleep through the night. Some things that will be helpful, in addition to what we talk about for sleep training, is having the lights off at nighttime, lights on during the daytime, blackout curtains in the baby's room. That's going to be really important because when the sun comes up, they may wake up. And then other things are going to be having a consistent bedtime, which can be hard for kids this age, but starting to get that consistent bedtime routine is also going to be important. And then they should be in their own crib at 6 months. It should be about time to switch out that bassinet if you hadn't already. And they should, you can start them on their back, but by 6 months of age, they should be able to roll over both ways. And once a baby's able to roll over both ways, they can sleep on their front or their back. So that's the great news, is that the baby should be able to sleep through the night. And we'll talk about sleep training. I will eventually make another video that talks about sleep training. So that is that. In terms of growth, babies double their birth weight by 4 to 5 months of age, so they should be doubled their birth weight by now. They triple their birth weight by a year, so somewhere closer to double than triple is where they should be at by now. And they should be following along their growth curves, not just for weight, but also for how long they are and their head size, so we'll follow that closely. We will also talk about changes at home. We'll talk about vaccines. So today is the 6-month vaccines. That's the last of the 2, 4, 6 month series. That's going to be the Pentosil, the 5-in-1 vaccine. And the ones in the Pentosil are the diseases that Pentosil protects you from include DTaP, which is diphtheria, a sore throat infection that causes the throat to swell up and close. We haven't seen in the United States for a long time. Tetanus, which in babies causes botulism, which causes floppy babies. We sometimes get it from honey. That's why babies can't have honey till a year of age. In adults, tetanus causes lockjaw, and you can get it from stepping on nails, and adults need boosters every 10 years. And then the third part in that Pentosil 5-in-1 is acellular pertussis, also known as whooping cough. Really important for babies because if babies get this, they can stop breathing, and we do sometimes see it in the community. So even here in St. Louis, Missouri, we do see it. I saw 3 cases when I worked at the hospital. Hey, buddy. And then the other 2 in it is Haemophilus influenza B, a germ that causes some ear infections and some pneumonias. It doesn't prevent all ear infections and all pneumonias because lots of other germs cause that too. But it has decreased the amount of ear infections and pneumonias that babies get. And then the last one in that vaccine is polio. So those are in the Pentosil. The other 2 that will be due today is the 3rd hepatitis B and the 3rd pneumococcal vaccine. And then there's a drop in the mouth, that's technically a vaccine, but not a shot, but a drop in the mouth. And that one's called rotavirus preventa diarrhea illness. So that is the vaccines. Development is also a really, really important thing that we'll talk about today. So a few things that I want them to do by 6 months. Number 1, for communication, they should make those single vowel sounds like that ah, that ooh. You can kind of heard Harrison make some of these noises today. They should be babbling. Sometimes they make a lot of noises. That is for communication. For gross motor, they should be able to roll over both ways. They should be able to sit up with support. Now that confuses a lot of parents because they should not necessarily be sitting on their own at 6 months of age. If they are, they're advanced. But I wouldn't expect that Harrison doesn't sit up on his own. But if he leans against something, he should be able to sit with support, so leaning against something. Sometimes if they put their hand down, they can hold themselves up too. But again, if leaning against something, he should be able to sit. Fine motor, they should be able to switch objects from one hand to the other. So if they have something in one hand, switch it on over to the other. So that is fine motor. And then personal social, they should really be more interactive with you. They should be calming down when you talk to them or sing to them. They should smile with you, like to play with toys more. All of those things are what I would be expecting for at 6 months of age. So that is kind of what we go through at 6 months. What we're going to do next is his exam. He's a little fussy now, but we'll go ahead and do that exam anyway. I'm sure if I put him down, he'll be real upset, but we'll go ahead and get this done, and so we can get him with his clothes back on. So Mr. Harrison is right here. So we're going to fill that soft spot on the top of the head. The soft spot on the back of the head should be closed up. Again, you can treat it like any other spot on the body. We're going to look in the ears. I don't have the otoscope today, but we're going to look in both ears, make sure that they are normal. If he's had past ear infections, make sure that they've healed up. Look at that smile. Look at that smile. Yeah, you want to show them? You want to show them? We'll look at their eyes. We're going to check for that red reflex, make sure their pupils react. We're going to feel their neck for the clavicles. We're going to use a tongue depressor or a tongue pusher and look in the back of the throat to make sure that's all normal. We're going to feel the chest wall. We're going to make sure the arms move. We're going to listen to those heart and lungs. That's really, really important. Say, he just wanted me to interact with him and not just talk to you guys on the video. Heart and lungs are completely normal. We're going to feel that belly. Yes, we are. We're going to feel that belly of yours. Make sure that there's no big liver and no big spleen. Make sure that there's no masses in the belly. Make sure the bowels are all normal. We listen to the bowels too. We would normally take the diaper down. I'm not going to do it on this video. And we'd feel for the pulses here. For boys, we want to make sure their testes are descended. We want to make sure that their circumcision is well healed. And for girls, we want to make sure that there's no adhesions. And make sure there's no other big problems or diaper rashes down below. We'll check their hips. Their hips are the ball and cup joint. And so we want to make sure that ball is actually in the cup, not outside of it. So we push down, and then we pull forward. And Harrison loves that. Yes, you do. And then we take off the socks. Take a look at those toes. Make sure you have a good, what we call plantar response or Babinski. So here, plantar grasp. Perfect. That's normal. Check that Moro response where you just hold up and let go and perfect. Say, you're so good. You're so perfect. Let's see how strong you are. We'll lift them up. You should have good head support. Whoop. There we go. And then sitting with support is going to be kind of like this. We put a hand behind them and they should be able to kind of hold themselves up. And so he does it okay. Again, parents, don't be worried. Sitting with support, and you may not think your kid sits yet, but sitting with support does require a lot of support. So just know not to worry, not to freak out. And then we're going to feel along the spine. We'll check the head to toe skin. We take a look at the bottom too. I'm not going to do that today. And so then we talk about any concerns or things that you found on their skin or on their body or that you're worried about. And we'll talk about all that today. And so that is that. The last part is we'll go over the anticipatory guidance. So what to expect between now and next visit. We already talked about feeding. That's a big thing to talk about between 4 and 6 months. Sleep training is going to be a really, really big one. That I will record a separate video on. But that's going to be really, really important. Baby proofing the house. That's going to be a big one too. Because between 6 and 9 months, a baby's going to learn to crawl. So baby proofing the house is going to be really, really important. Some things that you need to do to baby proof the house. Cover electrical outlets. So get those electrical outlet covers. Appliance cords, window covering cords should be kept out of reach. Household plants, cleaners, poisonous plants, which hopefully you don't have too many of those in your house. Medications and other potential poisons should be kept out of reach. You can get those locks to go on cabinets. I highly recommend that too. While we're speaking of this, you want to have the number for poison control programmed into your phone. So I'm going to mention those now just so you can put that in if you're a parent watching this. So number for poison control, I want every parent to have in their phone just in case the kid gets into a cleaner, any chemicals, or any pills from a family member. Hopefully it never happens. It sounds like something that never will. But unfortunately we do see it happen. Don't feel bad if it does. Just call poison control right away, okay? So poison control is the number 314-772-5200. Again, that's 314-772-5200. There's a second number for poison control as well. If you want the other one, it's going to be, that's a 1-800 number in case you need that. That's 1-800-222-1222. So pretty easy to remember that one. 1-800-222-1222. If they do get anything, that's the first number to call. Don't call our office first. Call poison control first, and they'll tell you what to do. They'll ask you a few questions and help you out.
Stairs and open windows should be guarded with rails. That's going to be really, really, really important. That's another thing I want to mention is walkers. We don't recommend walkers because they often go downstairs. Kids and babies often get injured. They don't teach babies how to walk because they don't help with balance, and balance is really the thing that they need before they can walk. So we don't recommend walkers. If you want to have one of those things they can hold onto and push forward, that's okay, but the walkers with the wheels that they just like move around in, we usually don't recommend them. If you already have one, just make sure they're not going to go downstairs. But again, they're not recommended by the AAP. The hot water temperature should be below 120, which we've talked about. Sharp objects should be put out of reach. Swimming pools, hot tubs, bathtubs, toilets, containers with waters, fireplace heaters, those are going to be all off limits. Garage door openers should have safety devices on them. At 6 months, a good time to lower the mattress in the crib, just because they're going to start pulling up the stand soon and you don't want them to fall out. So a good time to lower that crib mattress. Get everything off the floor. You don't want them having their mouths. Lock those drawers. All those things are going to be important for baby-proofing the house. Other things to talk about for anticipatory guidance, we talked about feeding, introducing those baby foods once a day at first, then 2 to 3 times a day, finger foods at 7 to 8 months. I have a handout that I give a lot of parents in the office about it. So those are things that are really important. If you're breastfeeding, the vitamin D drops are still important to do. If you're bottle feeding and the baby's getting over 32 ounces of formula, which at this age they should be getting over 32 ounces of formula, then you can stop if you want, but it's not going to hurt to continue. And I actually do recommend continuing those vitamin drops either way. And then those are some of the big things that we recommend at 6 months. A few other things is small objects should be off the floors, especially button batteries, batteries of any sort. We don't want them swallowing those. Those could be a really big deal if they are swallowed. Keeping kids out of the sun at peak times is important. Wearing sunscreen. There are baby sunscreens. Those are the mineral sunscreens. So zinc oxide is a common one. But we want it to be a PABA-free sunscreen. That's capital P, capital A, capital B, capital A, free sunscreen. And you want it to be an SPF of 15 or above. Insect repellent is okay to use. DEET of the 20 to 30% works best. So we do think it is safe to use that. So that's really, really important. Shoes do protect the feet from sharp objects in the cold. But again, at this age, they're not walking a lot, so you don't need a lot of shoes. But once they start standing up, that's a good time to start using shoes, so usually around about a year. So those are the big things that we talk about at 6 months of age. Again, thank little Mr. Baby Harrison for doing such a great job with this video. He does like to eat my stethoscope. Again, at this age, they love to put everything in their mouth, and that's what I expect. Some things that you should worry about in terms of development. If by 6 months of age, the baby doesn't try to reach for things, like he's trying to reach for this towel now, or this tablecloth now, or my stethoscope before. Again, sometimes. It doesn't have to be he's always trying to reach for things, but sometimes try to reach for things. If he shows no affection towards caregivers, like smiles back at you, if he doesn't respond to sounds, like isn't looking, we want him to check his ears again. If he has difficulty like trying to put things in his mouth, like Harrison's right now putting my stethoscope in his mouth as we speak. I'll need to wash that before I use it again. If he doesn't make any sounds at all, doesn't roll over in either direction. So if he rolls over one way, again, we want him to roll over both, but if he rolls over one, we'll watch closely, but if he doesn't roll over either way, we need to know about it. If he seems really stiff and can't really move his legs much and muscles seem really hard, we'll know that. Or if he's super floppy all the time, those are reasons to talk to your pediatrician. But I'm going to call that a day. I hope you enjoyed this episode of Virtual Visits with Dr. Ted, and I can't wait to see you and your child at our next visit. Say bye!